Hi, everybody. It's Dr. Langford. I wanted to give you a few travel tips for leakage. So, women that have incontinence are always worried about traveling. So, I think there's a few things that are worthwhile to learn. So, first of all, I suggest that you plan strategically. If you are driving, you really need to plan out bathroom breaks about every 2 to 4 hours. Regularly, even if you don't feel like you have to go, and then use some apps that are useful for finding restrooms. For example, Google Maps has good information about rest stops. There's another one called USA Rest Stop Locator that's useful. Or there's another one called Flush Toilet Finder that helps you to find restrooms along your route. So don't push it so that you're out of luck by the time you have to go. The other thing I recommend is if you're flying is to use an aisle seat at all times. It's difficult, especially when traveling with people that you don't know, to climb over top of them. And when you're on a plane, it really isn't up to you when you can get up. It's really up to the pilot. So make sure you go before getting on the plane, maybe limit a little bit of fluid intake before you get on the plane, and try and get an aisle seat if possible. The other recommendation I have is to pack essentials with you. Bring an extra pair of underwear, maybe wear a pad just in case. Bring some plastic bags so that if you do actually have an accident, you can put your clothing into that and it won't smell around other people. Now, the other thing you can do is manage your fluid intake beforehand. Ironically, you do need to stay very hydrated when you're traveling and also to prevent urinary tract infections and to uh, keep you from having too concentrated of a urine and something that would cause you to have irritation to go. But before going on a plane, you might want to watch caffeinated beverages, be careful about alcohol, carbonated beverages, artificial sweeteners, spicy, acidic foods, things like that. So I would say stick with water, really hydrate the day before, and then maybe limit some fluids in the morning of. The other thing in the long term for travel is obviously to practice urge suppression. So really train your bladder to behave the way you want it to. Consider some urgency exercises and distraction techniques. So if you really have to go, maybe start thinking about other things other than having to go to the bathroom. And then the other thing I would suggest is that you really work on Kegel exercises. When you feel like you absolutely have to go and cannot hold it, tightening those muscles really helps to kind of reset the ability to hold the urine in. So you could do 5 quick Kegel exercises where you tighten those muscles as if you're stopping your urination. Relax, count to 5, and then tighten them again 5 times. That can help you to hold your urine a little bit longer so that at least you get to a bathroom rather than having an accident. So I hope this helps and stick with me for some more bladder tips.